Thank you for choosing Juniper Dentistry for your whitening needs. We offer a variety of products here at Juniper Dentistry for different whitening needs. The first option is an in-office option. Ideally, we would have this treatment done about 2 weeks after your cleaning, and this is to make sure that your teeth are nice and clean with no plaque or calculus present to make the whitening not work as well. So for this procedure, it is an in-office procedure. It usually takes between 1 hour to 90 minutes. We get you settled in. We take a before picture to get the proper shade, so we have something to compare it to afterwards. Once we get your picture set up and get you nice and comfortable, we'll place some Vaseline over your lips to protect your lips. We do need to put in a cheek retractor in order to protect your cheeks, your tongue, and your lips from the whitening material. The whitening material is known as opalescence. It involves 40% peroxide, so we do not want that to get on any of your soft tissue at all. It can be quite painful afterwards, and so we want to make sure that that is nice and protected. So we will put a cheek retractor in that will hold back your cheek and your tongue. We use a retractor that is a little malleable, so you're able to close down slightly to give your jaw a break. Once we have that all set up, we will put a protective layer over your gums to protect it from the peroxide. You'll see us use a light over this protective layer. It's also known as Opa-Dam. The light is hardening it so that none of the whitening material can get underneath and get on your gums. Once that is all set up, we will place the whitening material right onto your tooth, and it'll sit there for about 20 minutes. And we will let that work through, and what the peroxide does is it destroys any of the pigment that have gotten stuck in the first layer of your tooth. So that's how it whitens, is it actually is able to penetrate into the enamel and get through and get rid of the pigmented discolorations. After 20 minutes, we will suction off all the whitening material and assess to see if we're light enough. Typically, a session will be between 1 and 2 applications, so that's 20 minutes each, where we'll put a fresh layer of whitening right onto the teeth, and then suction it off in between, and again we'll assess how white your teeth has gotten. During this time, we will be suctioning out any water in the back of your mouth to try and make you as comfortable as possible as well. Once we are all set and we are happy with the way how white we've gotten your teeth, we'll go ahead and rinse your teeth out, rinse your teeth off, and just let you see the fantastic look of it. We'll place some vitamin E oil over all of your gums just to make sure that they're nice and healthy, because sometimes just manipulating them can make them irritated right afterwards. Sometimes if there's any sensitivity afterwards, it may be a good idea to take some ibuprofen right away. Take upwards of up to 600 milligrams if you're having any sensitivity. It will resolve within the day, but I understand that can be quite uncomfortable, so we want to make sure that we are proactive with that and that you aren't uncomfortable afterwards. The way you maintain the whiteness right after the whitening procedure is avoid anything that can stain your teeth. So that's things like coffee, tea, any sodas really, especially within the first 48 hours. Your teeth are particularly porous at that time due to the procedure, and so they have the potential to get staining back into the tooth right afterwards, especially within 48 hours. We will be sending instructions home so that you have those available as well to review over after the procedure. We will also be sending you with a small touch-up tray. You can use that about a week after if you want to maybe whiten just a little bit, or you can hold on to it and use it a little bit further down the line if you feel you need to have just a little bit of a touch-up to your whitening. The other option we have is a take-home system called Opa Go. That has 15% hydrogen, 15% peroxide in trays, and we give you a series of 10 trays that you can use over the course of 2 weeks. For 15%, the 15%, you're having those trays in for a maximum of 15 minutes. And then it's a great way to work if it's hard to have something in your mouth for any length of time. Sometimes the in-office procedure, because of the retractors, can be a little uncomfortable. So the take-home kit is very useful for that. If again, having something in your mouth for any length of time is really uncomfortable for you. We look forward to seeing you here at Juniper Dentistry, and if you have any questions about whitening or any other procedures, please let us know. Thank you.